My name is Thaisa Vasilkova.
And I'm Angel Wong, and we are third years from the Elmira campus. The main subject of our study is obstructive sleep apnea, which is the most common sleep disorder in the US. It's mainly treated with continuous positive airway pressure, or CPAP, and we're concerned about it because it's associated with an increased risk of cardiovascular disease. The goal of this study is to explore the relationship between CPAP treatment and the autonomic nervous system. To do this, we measured heart rate variability, or HRV, which is the variation in time between each heartbeat. You see, a healthy heart is not a perfect metronome. The exact timing between beats, which is measured as the R intervals on EKG, actually fluctuates because there are so many factors that are constantly affecting heart rate, such as hormones, respiration, vascular tone, and of course, the autonomic nervous system. And this is why we can use HRV to assess the function of the autonomic nervous system. In order to assess how in order to assess that, we need to go over some of the variables we measure. So first and foremost is SDNN, which is the standard deviation of RR intervals. This is the most direct measure of HRV because the more the heart rate varies, the greater the standard deviation will be. Now, if you were to graph that over time, you would get a waveform. And if you take this waveform and convert it into the frequency domain, we can decompose it into measurements of high frequency and low frequency, or HF and LF. Previous studies have shown that HF reflects parasympathetic activity and LF reflects sympathetic activity. So we can use the ratio of HF to LF to evaluate the balance between the sympathetic and parasympathetic nervous systems. An increased HF to LF ratio means that there is increased parasympathetic activity. Our last variable is the EI ratio, and that's calculated by taking the difference between the highest RR interval and lowest RR interval during expiration and dividing it by that same value during inspiration. Essentially, it compares HRV during expiration to HRV during inspiration. So back to sleep apnea. Sleep apnea, like many other diseases, is a hypersympathetic state. We hypothesize that sleep apnea patients who have undergone CPAP treatment will have restored parasympathetic nervous system activity. To study this, we recruited sleep apnea patients from the sleep clinic at Arnott Ogden Medical Center, separated them into CPAP non-compliant, which was our control group, and CPAP compliant, which was our experimental group, and measured their HRV under a variety of conditions. And now on to my colleague Thaisa for results.
Thanks, Angel. To give us some background to Figure 1, when a healthy individual moves from supine to upright positioning, the heart rate increases rapidly and then decreases to a new baseline that is 10 to 15 beats per minute higher than the supine heart rate. This decrease is mediated by the parasympathetic nervous system. The control group had a significant increase in heart rate and a significant decrease in variation between R to R intervals going from supine to upright positions. In contrast, the CPAP group did not have as much of an increase in the heart rate, which suggests that the parasympathetic nervous system was better equipped to counteract the transient increase in heart rate going from supine to upright. The CPAP group also maintained HRV during the change in positioning, suggesting improved autonomic nervous system function as compared to the control group. Now on to Figure 2. As mentioned before, an increased HF to LF ratio signifies increased parasympathetic nervous system activity. The HF to LF ratio was significantly higher in the CPAP group when the participant was upright, and even more so during deep breathing. This indicates increased parasympathetic activity in the CPAP treated group under these two conditions. Lastly, Figure 3 shows that the CPAP treatment group had an EI ratio significantly closer to 1, meaning that HRV was similar during expiration and inspiration. In contrast, HRV in the control group was lower during inspiration than expiration. This indicates that HRV was maintained in the CPAP group during inspiration and expiration. In conclusion, we found increased HRV and increased parasympathetic nervous system activity, especially during autonomic challenges in sleep apnea patients who have used CPAP. This suggests that CPAP treatment helps to restore the autonomic function by increasing parasympathetic nervous system activity to counteract the sympathetic hyperactivity. This study also suggests that we can use HRV analysis as a non-invasive method of monitoring patients with sleep apnea. We would like to thank Dr. Maxime Krosta for his guidance and support, and NP Phyla Sassenberry from the Arnott Sleep Clinic for allowing us to perform the study. We would also like to thank the patients who participated in the study. Thank you.